Question number 1.
Brian, with renal failure, is currently undergoing peritoneal dialysis. During the infusion of the dialysate, he complains of abdominal pain. Which action by Nurse Mimi is most appropriate during this situation? A. Slow the infusion. B. Decrease the amount to be infused. C. Explain that the pain will subside after the first few exchanges. D. Stop the dialysis. The correct answer is letter C. Explain that the pain will subside after the first few exchanges. Pain during the inflow of dialysate is common during the first few exchanges because of peritoneal irritation and muscle cramps caused by fluid loss and change in electrolytes. However, the pain usually disappears after few weeks of treatment. The infusion amount should not be decreased, and the infusion should not be slowed or stopped.
Question number 2.
Brian is currently undergoing peritoneal dialysis. After the procedure and dwell time, Nurse Mimi observed that the drainage has stopped as only 500 milliliters drainage, while the dialysate installed was 1,500 milliliters. Which of the following interventions would be done first? A. Call the physician. B. Change the client's position. C. Check the catheter for kinks or obstruction. D. Nothing, as the output is considered normal. The correct answer is letter C. Check the catheter for kinks or obstruction. The first intervention should be to check for kinks and obstructions because that could be preventing proper flow of the drainage. Peritoneal outflow failure can be defined as the incomplete recovery of instilled dialysate consistently within 45 minutes of beginning a drain.
Question number 3.
Nurse Ivy is taking care of Brian, who is currently undergoing dialysis. Which of the following nursing interventions should be included in the client's care plan during dialysis therapy? A. Maintain peaceful and quiet environment. B. Pad the side rails of the bed. C. Monitor the client's blood pressure. D. Keep the client NPO. The correct answer is letter C. Monitor the client's blood pressure. Because hypotension is a complication of peritoneal dialysis, the nurse records intake and output, monitors vital signs, and observes the client's behavior. Decreased blood pressure, postural hypotension, and tachycardia are early signs of hypovolemia.
Question number 4.
Max, with an arteriovenous shunt in place for hemodialysis, is at risk for bleeding. Which of the following nursing priority action to prevent this complication from happening? A. Check the results of the prothrombin time as they are ordered. B. Observe the site once per shift. C. Check the shunt for the presence of a bruit and thrill. D. Ensure that small clamps are attached to the AV shunt dressing. The correct answer is letter D. Ensure that small clamps are attached to the AV shunt dressing. An AV shunt is a less common form of access site but carries a risk of bleeding when it is used because two ends of an external cannula are tunneled subcutaneously into an artery and a vein. If accidental connection occurs, the client could lose blood rapidly. For this reason, small clamps are attached to the dressing that covers the insertion site to use if needed.
Question number 5.
Because of congestive heart failure, Brian undergone a peritoneal dialysis to treat uremia, which finding signals a significant problem during this procedure. A. Potassium level of 3.5 milliequivalents per liter. B. Hematocrit HCT of 42%. C. Blood glucose level of 120 milligrams per deciliter. D. White blood cell WBC count of 20,000 per cubic millimeter. Let's apply the process of elimination. The normal serum potassium level ranges from 3.5 to 5.2 milliequivalents per liter, making option A a positive statement. The normal hematocrit level ranges from 36 to 50%, which makes option B a positive statement. The normal blood glucose level ranges from 70 to 100 mg per deciliter, and a slight elevation is expected due to the dialysate solution, which makes option C a positive statement. The normal white blood cell count ranges from 4,500 to 11,000 per cubic millimeter, making option D a negative statement and is a sign of infection. Therefore, the correct answer is letter D.
Question number 6.
Patient Mark, who is undergoing hemodialysis with an internal arteriovenous fistula in place. What do you do to prevent complications associated with this device? A. IV lines should only be inserted above the fistula. B. Avoid taking blood pressures in the arm with the fistula. C. Palpate pulses above the fistula. D. Report a bruit or thrill over the fistula to the doctor. Let's apply the process of elimination. An arteriovenous fistula, also known as AV fistula, is a connection that's made between an artery and a vein to facilitate proper blood flow required for hemodialysis. IV lines shouldn't be inserted in the arm used for hemodialysis. Untreated veins cannot withstand repeated needle insertions because they would collapse under strong suction from the hemodialysis machine, making option A a negative statement. Don't take blood pressure readings in the arm with the fistula because the compression could damage the fistula. Do not let anyone put a blood pressure cuff on the access arm. An AV fistula causes extra pressure and extra blood to flow into the vein, making option B a positive statement. Palpating pulses below the fistula can cause damage and injure the site of insertion. This is not encouraged for patients with hemodialysis. This makes option C a negative statement. A bruit describes the sound of blood flowing through a narrowed portion of an artery. Using the bell of the stethoscope, here is an actual sound of a bruit. It makes a swooshing sound, and it can be indicative of a clogged artery, while a thrill is an abnormal vibration that is felt on the skin which indicates narrowed blood flow. The presence of these is already an indication of possible damage and infection of the site of insertion. This would mean you have not properly taken care of the client, making option D a negative statement. Here are the basic don'ts for patients with AV fistula. Do not let anyone start an IV line or draw blood from AV fistula arm. Do not let anyone take blood pressure from AVF arm. Do not sleep on AVF arm. Do not carry heavy weights with AVF arm, no more than 10 pounds. Do not wear a watch, bracelet, or tight clothes over AV fistula. Lastly, do not allow straps or handles tighten around the fistula.
Question number 7.
Mark, who is currently undergoing hemodialysis, suddenly becomes short of breath and complains of chest pain. He became pale, anxious, and tachycardic. Nurse Mimi suspects for a possible air embolism. Which of the following actions should be a priority? A. Continue the dialysis at a slower rate after checking the lines for air. B. Monitor vital signs every 15 minutes for the next hour. C. Bolus the client with 250 milliliters of normal saline to break up the air embolism. D. Discontinue dialysis and notify the physician. The correct answer is letter D, discontinue dialysis and notify the physician. An air embolism occurs when air or gas is admitted into the vascular system. This means that anything downstream from this blockage will lose some or all of its blood supply. Immediately discontinue the dialysis and notify the physician. Elevate the head of bed or have a patient sit up in a chair. Promote deep breathing exercises and coughing to prevent further complications.
Question number 8.
Nurse Mimi is providing care for Brian, who undergone left arm fistula. Which of the following manifestations may indicate that the client is currently experiencing Steele syndrome? A. Aching pain, pallor, and edema in the left arm. B. Pallor, diminished pulse, and pain in the left hand. C. Edema and reddish discoloration of the left arm. D. Warmth, redness, and pain in the left hand. The correct answer is letter B, pallor, diminished pulse, and pain in the left hand. Steele syndrome or ischemic Steele syndrome, ISS, is a complication that can occur after the construction of a vascular access for hemodialysis. It is characterized by ischemia of the hand caused by marked reduction or reversal of flow through the arterial segment distal to the arteriovenous fistula. In extreme cases, it can cause tissue death known as gangrene, which may lead to the loss of fingers.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.